For the first procedure, prepare the necessary materials in the assigned isolation room in order to save both time and energy. For soil materials to be thrown right away and cross-contamination is avoided. So for the substitute of my yellow garbage bags is a black garbage bags, and the substitute for my surgical tape is a masking tape. Second, wear gown, mask, cap, and gloves to keep the client and the nurse safe from any potential high risk. It also slows or stops the spread of infection, and for safety and security. Third, prepare the two garbage bags. Fold back the opening for bigger or wider opening. So the first bag is placed in the patient's room, and the second bag is placed near or outside the patient's door. So the two garbage bags will be used to dispose of the patient's materials. So folding the garbage bags opening back allow for larger opening and easier disposal of the patient's soil materials. So it also keeps the nurse from touching the garbage bag surfaces. So this is for safety and security. Fourth, when the patient is wheeled in the room, remove the linen covering the patient, touching only the outer part of the lining, and place it inside the first bag to prevent from touching or acquiring the microorganisms that the linen has and to prevent spread of infection, and for safety and security. Fifth, transfer the patient to the bed from the wheelchair. Place wheelchair parallel to the bed facing the foot part. Check if the wheelchair is locked, so it is parallelized so that the client can easily access it. And to avoid injuries, make sure that the wheelchair is locked, and to save time and energy, and for safety and security. 6. Remove the linen covering the wheelchair. Untie first the lower knot, making sure not to touch the contaminated part, and place it inside the first bag. It is to protect the nurse from contracting the infectious microorganisms found in the soiled linen, and this is for safety and security. 7th, remove the patient's cap followed by the mask. Place it inside the first bag. Close the opening by twisting its upper end. Removing the client's cap and mask slowly to avoid the spread of microorganisms, and disposing of it thoroughly in the first bag. This is for safety and security. 8. Place the first bag inside the second bag, which is outside the room, to ensure that cross-contamination does not occur, which could later be transmitted to the hospital personnel dealing with them. This is for safety and security. 9. Remove the cap, mask, and gloves together with the gown and place them inside the second bag. Lastly, secure the bag with a tape and label it with the room number and type of isolation. Indicate if the article is contaminated with blood and other drainage or secretions. So tape the bag to prevent any contaminated secretions or materials from leaking out. It is also a good idea to label the bag containing the soil materials so that the healthcare workers who will be handling and transporting it later are reminded to use standard precautions to limit and prevent infection spread. This ensures not only the safety of the healthcare workers but also the safety of the patient, and this is for safety and security.